Hi, everybody. This is Dr. Eliana and Director of EMA Care, and I'm here with Dr. Jonathan Marcus, who is the chief of a large ICU in Florida and head of telemedicine ICU care. You work in a company and you're the head of the telemedicine clinical department. Am I right?
Like a medical director right now.
That's even better. So I'm going to ask you a few questions that are pertinent to what's going on right now, because we're all going through a very hard time, especially you. There's a lot of press about burnout and stress for ICU doctors and nurses regarding this wave that we're having right now. Could you tell us a little about your experience?
Sure. Yeah, the second wave of COVID, it's actually the third wave of COVID, really hit us very hard. I think it's a combination of patients getting readmitted, combination of just the sheer volume of patients that are being admitted, the age of the patient being very young, which obviously has an emotional part to that, seeing healthy people that are infected. And also the part about resources. We've lost in Florida over the last year and a half, we've lost a large portion of our nurses and the therapists, as well as doctors, from burnout, from the pursuit of better paying jobs. So to be understaffed and to be overwhelmed with these things is it's been very difficult last couple of weeks.
You're right. I saw in today's numbers that there are over 600,000 sick people in Florida right now with COVID. Yeah. The ICUs are packed?
Yeah, the ICU is packed. Depends on where you are. There is a regional piece to it. If you were to go to mid-Florida, sort of the Orlando area, Tampa, it's hard to find an ICU bed. There's COVID patients intubated in the emergency rooms and overflow units. If you come down here to the Delray Boca area, most of the patients that have been in our hospitals, so it's a pretty high mortality rate. I would say for the young ones, it's probably close to about 30%. As you get older, obviously, it's much higher than that, close to 70, 80% mortality rate. But I think for this, the last 2 days, we've had, unfortunately, a lot of mortality, so that's cleaned up some of our beds. And then if you move down to the South Florida area, they're still inundated with numbers, but the numbers are there. There's a lot of people. Again, it's doesn't seem like a large number, but when each one of these patients is on a life support, right? When they're intubated, when they're on paralytics, when they're on, on dialysis, when they're on pressors, when they just incredibly sick. That along with the family, the nursing shortage, it's very tough. It's very, very tough.
So these are a lot of young people who basically their whole body is shut down. Their kidneys, their heart, their lungs, their brain, everything is just going.
Some of them have sort of an isolated, a singular organ involvement. So their lungs are shot, the rest of the body is fine. Their heart is shot, the rest of the body is fine. So it depends on, it seems like different people have different manifestations, but generally, the body itself is healthy. It's just, they have this overwhelming infection. So it's harder for us because.
I'm sure it's harder for you. It sounds absolutely awful. But what's different about the Delta wave? I'm calling this the Delta wave. In Israel, this is our fourth wave. For you, it might be the third. But what's different about this one versus the first and the second one for you?
The first wave, we had nothing. We really had nothing. We had no treatment. We did everything we knew. Every day there was people all over the world making this suggestion, making that suggestion, swearing by this therapy, swearing by hydroxychloroquine, swearing by ivermectin, swearing by high-dose vitamin C, swearing by all these therapies, and people get very emotional about that. This works. I know. I spoke, and we tried everything. We tried it at different doses, higher doses, and nothing seemed to stick at a consistent level. you have one person that survives, that means it worked, but 10 of them didn't survive it long. So the first one really caught us, and it seemed to have affected people with comorbidities, which tend to be older people. I would say in the 60 plus range. And then when you talk about sort of that mid range, the 40, 50 or 50, 60 get affected, people with other conditions, diabetes, hypertension, obesity, especially, and any kind of immune compromised state. And those patients just got, they were decimated. That age group was really decimated. The middle stage that we saw, sort of the resurgence here in Florida, probably was
the second stage you're talking about.
The second stage, right, which happened kind of like the late summer after that. We attributed to the influx of people from the Northeast, people that were hit first or earlier, people that were under the false pretense that I had it, therefore I am immune. And we had a lot of cases of people that didn't get the vaccine, refused to get the vaccine. And they were reinfected. And then we realized having the infection once does not confer immunity. And the problem is that you're also fighting against media figures, people that can get online, that slap an MD behind them, that slap some credentials behind them, that tell people or try to guide them in one way or the other. And maybe they believe in what they're saying, and maybe what this is all publicity. But the bottom line is, look at the results. Look how many people saw those programs and swore by it and died. They're no longer with us. We also had people that couldn't handle being locked up, if you will, and they had to see their grandkids or had to go to the event, or everything is safe. And we had couples, husbands and wives that died. We had children and parents that died. So that was pretty bad. This time around, we're calling the Delta. This is after the vaccine's been available now for the last 7-8 months. There's been efforts to get people vaccinated, and a lot of resistance for people getting the vaccine. A lot of it's driven by media figures, people out there that are giving advice. Don't take it. It causes birth defects. Don't take it. It doesn't work. Don't take it. The government's trying to create some kind of genetic abnormality in us that they can track us. I mean, I've heard a lot of this. Let's put all that aside. The bottom line is that you have an influx right now. And over 90% of the people that are dying, that are succumbing, are people that were not vaccinated. I was in Israel just
90% of the people who are dying are unvaccinated.
Correct. That's the number. Now, I was in Israel 2 weeks ago, and of course, you land, and people just feel like they want to come over, they want to talk to you about these things. Be honest, I really don't want to talk about it. If I can talk about other things. But they feel like they have to make their point. And I heard somebody made a suggestion that, I heard from somebody that most of the people dying were vaccinated, and therefore the vaccine doesn't work, and therefore not get vaccinated. And obviously it's false pretense. It's kind of like the world that we exist in. If you have one person that's vaccinated that ends up dying from COVID, as soon as it's like the Norman Rockwell picture, as soon as everybody starts talking about it, before you know it, everybody, in fact, the vaccine causes people to die.
We had the same thing when the vaccine started in Israel. A 94-year-old got vaccinated and died a few days later of a heart attack. Oh, the vaccine killed her. She was 94.
She was healthy. Yeah, I mean, listen.
She had cardiovascular disease, but all they care about is that she died, and it's fake news. It's
right. Listen, last night I had a rare case. I had a guy that came in with chest pain. This is a crazy case. Listen to this. A guy that came in with chest pain that did an EKG, right? He was having a heart attack. We took him to the cath lab. We stented him, and he's doing better. Had nothing to do with COVID. He has coronary artery disease. It's, it's like everybody's trying to attribute this, and there's a lot of emotion, and there's a lot of lines that are driven. But at the end of the day, we know that any kind of vaccine, the whole point of a vaccine is that the body has to do work. It's like life, right? I'm not going to do it all for you, right? Your body has to, mount an immune response. Your body has to be able to produce proteins enough in this case so that the body can, mount an immune response. And there's certain people that are immune compromised. It doesn't work for everybody. We know it won't work for everybody. Nothing works for everybody. no vaccine out there that works for absolutely everybody. So the idea over here is that,
A lot of that, a lot of that, sorry for interrupting, a lot of that fake news about like more people are sick who have corona, a lot of that is also people who don't understand at all statistics and don't understand epidemiology, and they look at the raw numbers because 90% of the people 60 and over in Israel are vaccinated. So the chances are like 15 times higher for the 10% who are not to die and to get critically ill, but there's a lot more people in the 90%, and they don't understand how that rate works, and they don't get it.
Right. So I look at it one step further, because I've had a lot of time to think about this, and I think that the world that we live in is a world of black and white. Are you for it? Are you against it? Are you going to get vaccinated? You're not going to get vaccinated. What line do you sit on? And then you decide on your line, and then you sort of support it with whatever makes you feel comfortable. It's I think it's one of the problems that we have in in Yiddishkeit. You have 12 tribes. Kadosh Baruch Hu, expects us to have people that are very different. Mashiach comes, not everybody's going to be Hasidic, not everybody's going to be Tzioni with God. It's not the way it works. Everybody's going to be different. You're going to be in shul with people that wear jeans. On Shabbos, you're going to be there with people with long hair. That's the beauty of it. That the world is all gray. The world isn't even gray. It's color. It's expression. And the problem is that at the end of the day, when you have that kind of hard line, I'm at the end of the day, these people that are dying, the last thing they're seeing is, me or my colleagues, my friends, my other doctors, a few of us. They're trying so hard to save their lives, but in many cases, nothing you can do.